Alarm as Pakistan detects three cases of COVID variant. Amritsar policemen checked the travel documents of Pakistani nationals who were stranded in India following the closure of borders in view of the COVID-19 pandemic before they were allowed to cross the India-Pakistan border on Tuesday through the Atari Wagah post, some 35 kilometers from here, AFP. MCSC advises masses not to get panicked, reviews national vaccine strategy by Faiza Ilyas and Ikram Junaidi. Karachi, Islamabad, has three cases of the potentially more uh, contagious coronavirus variant first detected in the UK were confirmed on Tuesday by the Health Department of Sindh. The Ministry of National Health Services (NHS) suggested to the masses not to get panicked. A spokesperson for the Ministry of NHS said, Sajid Shah said that out of five samples, two were being analyzed at the National Institute of Health (NIH) and three at the Aga Khan University Hospital in Karachi. According to the Sindh Health Department, 12 samples of UK returnees were taken for genotyping. Out of it, six were positive, and the three showed the new variant of coronavirus in the first phase. The genotyping showed a 95% match of the new variant from the UK, and these samples will go through another phase of genotyping. Meanwhile, the contact tracing of these patients is in a process, and their contacts are also being isolated, it explained. The NHS ministry said, based on the parliamentary analysis, the five samples of COVID-19 may have the variant reported in the UK. High risk, high risk new virus variants will lead to more deaths, warns European Union phase 10. Okay, that particular variant may be more transmissible, but there is no evidence so far to suggest that the infection caused by this variant is more severe. This strain has also been detected in other countries. The first case of the new variant, the variant of coronavirus, can be traced back until late September in the south of England, indicating that there was ample time for it to spread undetected across the United Kingdom and into other countries. Now that the alarm has been traced, scientists around the globe are actively searching for and tracking this variant that is thought to pass more easily between people. More than 50 countries have imposed travel restrictions on Britain in recent days to help prevent more spread. WHO Chief Tedros Adhanom Ghebreyesus, however, has warned against punishing nations that transparently share such information, saying only if countries are looking and testing effectively, will you be able to pick up variants and adjust strategies to cope. The National Command and Operation Center (NCOC) and also had also recommended suspension of flight operations with the UK and also issued new guidelines for passengers who had arrived from the UK or the Pakistanis traveling from different countries to Pakistan in coming days. NIH Executive Director Major General Amir Ikram had predicted that sooner or later the virus would reach Pakistan as incubation period of the virus was 6 days and there were chances that what is this picture showing? COVID-19 science timeline of discovery from knowing nothing about SARS-CoV-2 CoV-2 at the start of the year to like some certificate vaccines by December record breaking quest for knowledge year 2020. What does it says? Saying January 7, 2020, Chinese authorities identify a new type of coronavirus. Then January 10, the gene sequencing data of the new virus published. Then on February 20, first 3D atomic scale map of the spike protein published. Then on February 26, study in China finds a big rise in death rate of patients above age 50. Then on March 16, first human trials of the Moderna vaccine begins in the US. Then we see April 28, Dutch study finds a high occurrence of blood clot complications in patients. May 18, the loss of taste or smell adopted as diagnostic symptom by UK authorities. That's 200,000 deaths, okay, in that month. Then in the March, you can say, sorry, April, what month is it? May. May to June, it is about 300,000 plus deaths. Okay, now June 9 analysis concludes 40 to 45% of infected are asymptomatic. Then we see June 16 study finds U20s and the 50% less likely to be infected, but only 21% of them are symptomatic. 440,000 deaths by this time, okay, and July 7. WHO acknowledges the evidence of airborne transmission. Then you see August 11, Russia becomes the first country to approve a vaccine. Then by September 30, study finds transmissions mostly driven in clusters from a small percent of the infected. And by now, 739,000 plus patients died. That's occurred. Then we see on October 13, Lancet publishes a study of fifth confirmed reinfection. By now, you see in November, 1 million plus deaths occurred. Again, Pfizer, Moderna, and AstraZeneca all announced plus 90% phase 3 trial successes. Then November 14, Britain launches long COVID clinics to tackle persistent symptoms. And by December 2, 1.3 million plus deaths were recorded. Britain approves Pfizer BioNTech vaccine. Then on December 8, a British woman, Margaret Keenan, 90, is the first non-trial Pfizer vaccine recipient. And by December 14, 1.6 million plus deaths recorded. UK authorities report B117 virus variant that appears to be spreading rapidly. And this is AFP reports in UK, you can see. And what is this? A source of pharmaceutical technology.com, thinking global, think globalhealth.org/WHO. Okay, rest of the news. Continue from page 1. Alarm as Pakistan detects 3 cases of COVID variant. Okay, carrier of virus will be declared negative in the UK and later found positive after arriving in Pakistan. He suggested that every passenger should be tested and quarantined to ensure that the virus was detected. The, the government has taken a number of steps to respond to this development. On the 21st of December 2020, the NCOC decided to limit and restrict travel from the UK to Pakistan only to certain categories of travelers and only under strict protocols that mandated a negative PCR test before the flight. A PCR test upon arrival in Pakistan and quarantine as prescribed by the authorities. Moreover, track, trace, and quarantine policy was also initiated for passengers who had arrived from the UK. These measures are in place until 4th January 2021, the NHS Ministry's spokesperson said. In addition, viruses detected from individuals coming from the UK are also being evaluated in select laboratories for the presence of this variant. Based on this proactive effort, there are 5 samples which may have the variant strain. Based on preliminary analysis, these results have to be confirmed through further analysis. The whole genome sequencing, which will take some more days to complete, he added. He said the NCOC, National Command and Control, and NHS okay, and NHS Ministry were following it closely, and necessary updates will be provided in due course. Vaccine availability. Meanwhile, the National Command and Control (NCOC) in its Tuesday session reviewed national vaccine strategy, pandemic data, and efforts made to ensure early availability and administration of the vaccine. The forum was briefed on negotiations being made with the international vaccine manufacturers in order to get in time the COVID-19 vaccine. The forum was also briefed on a vaccine administration and the immunization plan and training of the staff. The expanded program of Immunization, EPI, representatives were directed to designate local points at district and FSC levels for grassroots level penetration of the program, said a statement issued by the NCOC, National Command and Control. The National Command and Control NCOC noted that the training of the staff should be spearheaded for positive and effective outcomes of the immunization program. The health experts highlighted the increasing ratio of COVID-19 positivity and deaths due to the deadly virus. The National Command and Control NCOC also resolved that non-pharmaceutical interventions, alternative measures to treat the virus or NPIs implementation should be ensured at all levels for mitigating the pandemic outbreak risk. According to the National Command and Control NCOC data, 1,776 new COVID-19 cases and 63 deaths were reported in a single day, and the number of active cases reached 39,599. Across the country, 305 patients were on ventilators. About 49% beds were occupied in Multan, 40% in Islamabad, 32% in Peshawar, and 32% in Lahore. Data of beds equipped with oxygen supply showed that 64% beds were occupied in Peshawar, 40% in Multan, 33% in Islamabad, and 31% in Rawalpindi. This is the end of the news. This news, and there are three more news. You can wait for them. Okay. In the end, the formal request: if you have not yet, subscribe our channel and press the bell button to get the press from us. Thank you for watching this video. Have a nice time. Goodbye.